It's a fascinating question whether healthcare is a right. And I look forward to the day when we can afford to give healthcare to everyone, and that we don't have the healthcare inequalities that we have in this country, because there's tremendous inequality. In fact, I think that inequality is what explains why the United States ranks so low when you compare us to other countries. Intuitively, that doesn't make sense to those of us in healthcare, because we know that we wouldn't go anywhere else for our healthcare. But I think that's because we can get the healthcare. And I think what brings us down is the tremendous numbers, the tens of millions of people that really don't have access to healthcare. So I think when you start at a high level and you say healthcare is a right, or everyone ought to have healthcare, I don't argue with that, and I think it certainly makes sense and is consistent with what's in my heart. The problem is the devil's in the details. And the problem is the sticky situations you deal with. So, first of all, what does that mean? Is it all healthcare is a right? Because we have previously said that feudal care is not a right, but yet people still demand feudal care. I remember a case from Texas when I was the hospital CEO where we had a patient who was brain dead, but the family couldn't let go. And I get that and I understand it. But because we were continuing to provide such high-level intensive care services, from the period of time that the patient was brain dead to the time when we could remove those resources, we had incurred a charge of $1.6 million. Now, did that family have the right to that health care? That's a tough question to answer. It was important for them to get to the point where they could deal with this. But it was $1.6 million that didn't add any value to anybody. And when the press talked to me about this and thought that this was a money issue, I said, it's not a money issue. I would rather go ahead and deal with the situation that that patient was actually dead and take that $1.6 million and go help seniors buy their medicine. Go help children get immunizations. Go help some people that were living on the street get them health care. So it's a matter of how do we use this. And the frank point is we can't afford it as a country. Today, not everybody has access to health care, and we can't afford it. Our Medicare program is in real risk of going bankrupt in just less than 15 years. Our states are struggling with their Medicaid programs. So it is nice, it is a good concept. I would like everybody to have health care, but we simply can't afford it. There's other questions of what does this mean. I had a situation of a prison inmate, and he was on death row, but his time projected for when he would be executed was still more than a year off. He had failing liver, and so they wanted to give him a liver transplant because he still has a right to health care, even in the prison. So is that a responsible thing to do? Or take the person who's still drinking. Do they have a right to a liver transplant? Well, in a time when there's scarce organs, I'm not so sure that's a good allocation of those resources. So there's these very, very, very tough questions. At a high level, yes, it makes sense. Say it's a right, it's a social justice. It is. But when you get into the details, it's very, very tough. My solution is I think that what we have to do is aggressively work to improve the healthcare delivery system. One of the biggest objections we had to the healthcare reform law is that the healthcare delivery system is broken. It's too costly, inefficient, and it's broken. Adding 32 million more people to a broken system is not going to save us costs. Let's fix the healthcare delivery system, and then let's take care of everyone. And at that point, we can afford it.